Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
Good afternoon, folks. This is Dr. Shailinder Sodhi along with my co-host, Dr. Anju Sodhi.
Good afternoon.
And it's a beautiful day today in Seattle, and I was just enjoying my driving along this. And there was quite a bit of traffic on freeway today. I think it's also opening of the boat season. So all of those, who love to enjoy this beautiful weather and beautiful outdoor, today we have a very interesting topic. And this topic is actually very timely because we are talking about alcoholism and alcohol use and abuse. So, as the springtime is here, the summer is not too far. So I think the part of thing we want to make sure that we cover this topic because it really affects lots of families.
That is true. It's really important, and a lot of people are suffering from this too. So we thought about this, to cover it, to tell there is always in Ayurvedic perspective, it's always considered whatever the food is, if it's taken in the right time, right quantity, it's a nectar, and if it's taken not at the right time and not in the right quantity, it's a poison. So it's considered as a toxin.
It's well said. And folks, so those of you who are just joining us, we are talking about alcoholism today and alcoholic abuse and what type of diseases it leads to and what supplements you should be taking and how you can actually manage it. I have traveled widely all over the world, and I see how different cultures use, and some cultures actually it's a part of their life and it is their routine in European cultures, and some cultures have rituals around alcohol that they use as a part of celebrations. And I'm from India and I grew up in North India, so I have seen use and abuse of alcohol in the northern India, but also it's commonly abused all over in India. And as the middle class is growing in Indian population, the use is also growing with it. So we definitely want to delineate that. We want to draw the line where alcoholism begins, where the reality of that you are addicted or you have an addiction pattern needs to be understood from the common use as a healthy use. So we will cover all that in today's topic. So folks, अगर आप हमारे साथ हिंदी, उर्दू और पंजाबी में भी बात करना चाहते हैं तो हमारे साथ कॉल करने के लिए 1-844-301-1250 1-844-301-1250 तो ये फ़ोन नंबर है यहाँ के स्टूडियो का. 1844-301-1250। तो हमारे साथ आप हिंदी उर्दू पंजाबी में बात कर सकते हैं। आज की जो हम बात कर रहे हैं वो अल्कोहल अब्यूज़ पे है, अल्कोहलिज्म पे है। एंड ये जो शराब के ऊपर जिसका कि हमारी सेहत पे कैसे फ़र्क पड़ता है और इसका जो बुरा उपयोग है, हम उसके बारे में बात करेंगे। तो आप हमारे साथ बात करने से घबराएं नहीं। अगर ये आपको, इफ़ यू नो समबॉडी or in your family is affected by it, it's something which we may be able to offer you some sort of a insight how it can be approached. So आप कॉल जरूर करें. तो anyway, not taking too much time, I think first of all, we should cover what alcoholism is.
Yes.
So for most adult, moderate alcohol use is probably not harmful. So that's like drinking one or two the max, once a couple, twice a week type of thing in a controlled manner does not fall into the category of alcoholism, especially if you do not lose your control on yourself. So if you are an individual who kind of crave for it, like that mean I need to have it, I have to have it, and you lose your control after that. That mean you do not have control on yourself, psychosocial pattern changes, or you feel like you have to have more of alcohol. That means I need to take a second one, I need to have third one, fourth one, and you do not know when to put a stop on it, then you definitely have a problem with it, and that can be alcoholism. And that's the issue. That's a lot of people do not understand where to draw the line. And these are the individuals when they have issues with the alcohol, that majority population, if they are having party or gatherings, or even at small birthday things, these are the people they will find themselves around the alcohol bar. That means they have to be there, and they just don't know how to put a stop to it. On the contrary, the people who are not, who do not have I will call weakness, or those who do feel like they're strong, they usually take one or two and then they feel fairly okay. And what happens in alcoholism is that pattern changes throughout the life. That means initially they might feel like, oh, they're buzzed with the 1 to 2, or they're really completely drunk. So their dependency on alcohol keep on increasing. That means they need to have more and more of this thing in order to feel the same sort of a high, or buzzed completely. So that's definitely a sign of alcoholism. So if we go by criteria which have been drawn, and in the medical world we like to have, we need to have a definition. So it's for the men, it is said if you consume more than 5 drinks, or if you consume 5 or more in 2 hours, you are alcoholic. In the women, if you consume 4 drinks in 2-hour pattern, you are alcoholic.
No, that's a lot.
That is a lot. But the reality to me is, in my point of view, I consider anybody who's alcoholic is someone who cannot control himself. That means the moment they start drinking, they just don't know when to put a stop to it. And that is a clear-cut sign of alcoholism. And also, people say, I only drink once in a while. Do I fall in category of alcoholism? Yes or no? Yes, you can, because you can be a binge drinker. That means you might pick a time, okay, all right, I don't drink a whole month. But as soon you start drinking alcohol and you cannot control your intake of alcohol, that falls into binge drinking, and that also falls into the category of alcoholism. So, this is a really serious problem. It can be a psychological problem, and there could be reason why people drink, and, we need to understand, though it is accepted behavior, it is every family consider, this is a routine. I mean, I traveled to Italy and France, and I have seen in Italian population, they start with their day with wine drinking, but it's accepted behavior, but they also know where to put a stop. I'm sure they have alcoholics in their society as well who have a problem with the alcohol. But so people always come and talk to me, even in our clinic. Well, what do you think of Europeans in Italy? They drink all day long. Yes, but they also don't get buzzed out. They also cannot, their perception of things does not change. They are able to make a right decision. They are okay. So that does not fall it. So the moment you start having behavioral issue, that you become a feisty, or you just don't know, if you stop making sense out of the things, that's an indication that you have a problem with alcohol. So that's a very important factor for people to understand the normal drinking versus abnormal drinking. And I'm sure we all have seen those type of population. So folks, we are talking about alcoholism and alcohol abuse. So if you feel like, if you know somebody, or if you just want to talk to us, feel free to call us at 1-844-301-1250. So, about 18 million people, that's a lot of people who are affected by the alcohol abuse disorders. And every year, about 3.3 million people kind of die from the alcohol-related issues, alcohol abuse. And about 80,000 people die directly because of alcohol drinking. So that's big number. It's a number 3 killer.
That is really big.
It's a sad statement, which I have to tell all my listeners, how devastating it can be for the families, for the parents, for the children, to see their parents or some close, their friend, just losing the battle against alcohol. So, there is always that, stigma in the, how to approach it. Can I talk openly to my doctor about it? Or can I really talk to my friends about it? Do I really have a problem? Accepting the behavior that you do have a problem is the first step in alcoholism toward the treatment. So if you do not realize, and if you don't think you have a problem, and you continue to this behavior pattern, you definitely lead to a status which really makes you keep on going toward the adverse path in your life. So what are the causes? What leads to alcoholism, or how do you know that you have alcohol dependence? Number 1 is craving. That you have a strong desire to drink alcohol. And if you don't, it's like you feel really, what is really going on? Why I have to have it in order for me to just be a normal. That's the first indication that you have an issue with alcohol. Second thing is loss of control, which I mentioned earlier. Not being able to stop drinking once you started, and you continue to keep on going. And then physical dependence. That means I have to have it in order to feel normal. If I don't drink, I get withdrawal symptoms. So that is another indication that you have alcohol dependency issue. Third is tolerance, which I mentioned earlier also, the need to drink more and more alcohol to feel the same effect. So all these factors are indicator of alcoholism. So if you know someone who has this type of behavior pattern, I really, really advise you to seek and help. And that can be very beneficial to just for your overall health. In Ayurveda, we always talk about creating a mental, emotional, physical aspect of balance. So this definitely affects all 3 levels. Any type of addiction which alters your behavior or physical aspect leads to a disease pattern, which really, it's one of those things which we can really stop and get back our life. We can really, really control this and become a healthy individual. With alcohol abuse, you are not only physically dependent, but you still have a serious problems. We mentioned about, it can lead to a problem at home, problem at work, problem at school, and all the different situations, or the legal issues or police issues, all that can be part of the alcoholism. The reality is if you start finding that you have more interest in alcohol than you have interest in your family or toward your work, or you start skipping work, or somebody at workplace tells you to leave the workplace because they feel that you're still drunk from the last night, it's a serious issue. You definitely need to address it. There is no easy way out. So, you have to face this. It's a big gorilla. You have to knock him out. You have to walk away from it and say, you know what, enough is enough and I need to take care of myself. One of the other things which we start with the alcohol is like, how people really get at first started with alcohol, And what we find is sometimes it's a behavioral pattern. That means either as a kids, they have their parents drinking in a normal behavior, and also saw their parents whenever there is a stress or depression or anxiety, they consume alcohol to just subside that effect. And children say, okay, if I have a stress, that means when I grow up, if I have this type of situation, it is okay because we accept that behavior.
Acceptable behavior.
It becomes a very much acceptance. Other time it's like, when even having presence of a lot of alcohol in the home sends the wrong message to the young adult or the young kids, and they accept that, okay, that's the acceptable behavior because they see alcohol. And you go to the stores, there is a special, lanes available where wine is available, hard liquor is available, and you think like, okay, I only need to reach my adult age and I can buy it and I can do exactly what my parents did or my relatives did, and I can do that. So all these are social issues which we need to address and we need to have an open conversation with our children that what is acceptable and what is not acceptable. And sometimes it is just like that day you see if the parents come home, or we all come home. I mean, even if you're not a parent, even if you're a single, you said, oh man, I have a long, tough day and I need to grab a drink. Fine. If you only grab a drink, and drink is moderate, only 30 ml or something like that, and you are not buzzed out, you're not knocked out of it, but what you do is one drink after another drink and keep on finishing. I know the people who said they can just be okay with one glass of wine, red wine or white wine, and that is a healthier pattern. That's a healthier. But if you are the one who start with one glass of wine and finish the one bottle, two bottle, then that's an addiction pattern. It definitely needs to be understood why we are doing it. What are the real reasons behind it? So folks, I will like to take a small break and we will come back. So we are talking about alcoholism and its abuse and how it affects our health. So in order to call us, 1-844-301-1250, 1-844-301-1250, and we'll be right back after the short break.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Welcome back, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju. And we both are actually covering on topic of alcoholism and its use and abuse and how it impacts our health. So before the break, I mentioned all the different scenarios. So, according to the Center for Disease Control and Prevention, they say the type of alcohol abuse pattern is easy to spot, and I mentioned how that is easy. There are people who sit down and attempt to down a great deal of alcohol at the same time. There is intent to the drink, lot of drinking. Actually, it involves that they want to be out of control where they don't realize that they have drank that much and they don't know when to put a stop. So, these are the very different drinking pattern. And one thing is common, that they all have no control on the drinking when we call alcoholism. So when you spot someone who is not able to control, or if you know somebody or you have that issue that when you're around alcohol and you lose your control, definitely you should be seeking help, because it does not only affect you, but it also affect the people who are around you. And it also affects your physical, mental, emotional aspects, your relationship, and it just affects you in every aspect of the physical
health.
Health
That's the main thing.
Right.
Like it has all the effects. It will affect all the organs in the body when it's when somebody is taking that much of
right
alcohol.
And also financial loss,
financial loss, it's expensive. So cardiovascular,
right,
like the lipids, everything it will, and then the fatty liver, so many things with the hypoglycemia. So it will affect almost everything. Anything can be caused with the alcoholism. So we will like to talk a little bit later about the how to deal with that, and what nutrition they will be losing while drinking that much alcohol too.
Right. And then the different types of alcoholics I am going to cover in short, and then we will start talking.
Yeah, it's a huge topic.
I'm telling you, this is I remember when we were in medical school, how big chapter it was, and how long it took to cover. And it was very painful to see the families, and I have seen people who have suffered from alcoholism, and the types of problem, the physical problem they had. So it's one of the things that I'm going to say, different types of alcoholics. So the first type is defined as the young adult subtypes. This includes young adult drinkers who don't have family histories of alcoholism or co-occurring mental illness. So these are the individuals who just happen to find that they can drink and drink a lot. And then we have the second subtype. It's called known as the young antisocial subtype. So these people have a little bit of adult young drinkers. These people do have a family history of alcoholism, and they also have co-occurring mental illness and addiction to other substances. So along beside alcohol, these are also doing other drugs. It could be street drugs, or it could be hardcore drugs along with alcohol. So these are the young antisocial subtypes. And then there is a third type, which is called functional subtype. These are the middle-aged and successful with a stable job and supportive family. They look very successful, and they have everything, whatever they need to achieve. And these are called functional alcoholics, the functional subtype. These are the people with a family history of alcoholism, and about a quarter of them have a history of depression. So there is a hidden things in the functional, and these are the most common one we see.
Yes, and depression is associated with the alcoholism.
Because they find they drink alcohol, and all of a sudden they feel okay, they come out of it.
Yeah, because it works on the GABA.
Right. So it's like a feeling good type of thing, and it opens them up. So, but that's the functional subtype. But they also keep on drinking because they want to keep on feeling, want to attain that good feeling. So these are the functional subtypes. And then we have intermedial familial subtypes. That's the fourth type. It includes the middle-aged people with a family history of alcoholism, and then there is a prior depressive episode that they have been diagnosed with depression clinically, and they probably are on some sort of a medication, antidepressant or something like that. And then we have the fifth category, which called the chronic severe subtypes, which includes middle-aged people with a family history of alcoholism, and there is a history of mental illness and addiction to the other substances. So there is a mental illness part in it, and then there is a substance abuse. So these are the 5 subtypes. So, if you think you have this type of issues, you need to talk to somebody. You need to talk to your friend, you need to talk to your family, or you need to talk to your physicians and see if you can be helped. Majority of problem with the functional subtypes, which I find is the most common one we see, who are the established and have good structure, they do not see that they have a problem.
They are not open enough.
Right. Not only, and they don't realize that they have a problem.
Yes.
And then there is a say that if you don't think you have a problem, you probably don't have a problem. That's what we say. But if somebody tells you that you look buzzed, and once you start drinking, you don't have a control on yourself, or somebody tells you at the workplace that your breath smells like an alcohol, or an acetone, which is a side effects of ketoacidosis, then you definitely have a problem, because it means you're not too far away where somebody gonna say, okay, we don't want you to work here, you can lose your job, or before you start, somebody going to say that you definitely seems like that you have a health issues and you need to be seeing your physician to overcome the issue of alcoholism. So, lot of things which we discuss in alcohol, it's just accepted behavior. Either we have seen somebody or we have depression or any of those type of things. So, there is a indication where we have suggested that alcoholism can stem from the genes. That you remember that alcoholic gene we discussed in the college days, the medical school days, that there is alcoholic gene. Though we have not yet found that alcoholic gene. And we call it that there is a weakness, but there is not really specific gene which is kind of targeted and pointed, okay, this is the reason we can target and we can do your genealogy and and we can see you have that or you don't have it. There is nothing like that. But people with these genes combination may have a bigger high drinking. That means you have a weakness, and genetically we find that you might have a weakness, and that's why you have a bigger desire to drink alcohol. And these are the people, they may not fall sick for a long time with the drinking because they had that gene. So, it's really, sometimes I have seen all those, and you probably have heard that too. Yeah, he drinks and he looks great, and it's just a matter of time. Because amount of alcohol consumed by affects directly our liver.
It's going to damage all the cells. Once it's in the blood, it will be damaging our cells, and then it's directly damaging because the liver is the one which helps in the detoxification.
Right.
And when it's affecting the liver, liver is not able to detox too, and we are having all type of problem. And then the fatty liver is and the cirrhosis. These are the concerns with the heavy drinkers. They have to deal with it.
Right. So, anytime we drink alcohol, it's like it converts into aldehydes.
Yes.
And the aldehydes are the one which are the very toxic material. It's I call it like a pesticide. It really kills the liver cells. And body has to clear those in order for you to function normally. So when you drink amount of alcohol, 1 to 2 glass, body usually can handle to, okay, I can survive. But the moment you start consuming 5 drinks or more and more, every alcohol drop which you put in your body converts into aldehyde.
Yeah.
And that's how the liver damage happen, and that's how alcoholic liver develops, or we call fatty liver. And fatty liver is just the first stage of cirrhosis. And the cirrhosis is by the time you have cirrhotic liver, you almost have reached the end stage of liver diseases, which can linger on for a while, and that's what leads to the future problems from the liver is esophageal varices. Varices are just dilated veins, which kind of affect in your esophagus, which is a food pipe, and it can happen in the abdominal cavities. And this is sometimes people say they had vomit and it was all blood in alcoholic. That's a clear indication that things have gone too far and it's almost an end stage, and you have an esophageal varices, which is a backup because all the blood flow which actually get backed up into the veins, small capillaries which are supplying to the food pipes, everything, and that gets swollen up with the blood, and they rupture because the pressure increases. Portal hypertension is another thing which can happen, which is in the stomach areas and the GI area, gastrointestinal area. These are all signs. And one of the other things is ascites, or when we see the swelling of the abdominal cavity happens, that means the back, because of all that plasma which is coming out, and the liver is not able to kind of do anything, and the backflow happens in the vasculature, and that start leaking, and the liver is also leaking the fluid into the gut, and the gut starts getting big, and then we start seeing free fluid in the abdominal cavity. That's an indication of ascites, and that's really end stage when we have seen that, and you don't want to be like that. So these also the most common things, these also leads to the heart diseases. You can develop in the cardiovascular, diabetes. All these are the other tertiary diseases which happens with alcoholism. Being overweight, obesity can happen.
And hypoglycemia is a major issue too.
You're right. When you drink a lot of alcohol, that's what happens. The mechanism is that it, body kind of lowers the blood sugar to the level where these people don't even know, they don't feel any energy, and their sugar levels are
drops quickly.
And that's why, sometimes these people are eating big and bigger meals.
Yeah, so then sometimes they will be, if they are hypoglycemic, they are eating big meals, and then they do not realize what they are eating too. And the other fact is with the nutrition, like the alcoholics, they are not eating enough calories. When they are drinking so much alcohol, then they feel like they are substituting food with the drink with the alcohol, which is the calorie rich substance.
Right.
And then there is a problem that leads to the hypoglycemia.
And then these are the people who are actually underweight. They lose all the muscle mass, and ketoacidosis takes place.
So it goes like the obesity and the
two extremes, right?
Two extremes.
The one extreme is when you're overweight because you're drinking and you're eating a lot just to maintain, and the other is that,
and that leads to the diabetes and all those like you mentioned earlier.
Right.
So then there is like the lot of the nutrient deficiency. So like the different nutrients, like the zinc deficiency is like the major one too, with the intake of the alcohol, with the our body cannot absorb it, and the one is like because of the dietary. So
that means the food which maybe even you taking it zinc rich food, but you're just having
you're not absorbing. And the first thing is like because your intake is not good, you're not having good
food,
and then there's a dietary decrease,
right?
And then your body is not absorbing. That is the another one. And then there is like low serum zinc levels are associated with the lot of other problems.
Right. And zinc is very important mineral, and it's such an important mineral for our immune system. And this zinc takes so much part of the biochemical pathways. People don't even realize how important it is. And by drinking too much alcohol, we are inhibiting the factor.
We are inhibiting. And then like when we are treating like the zinc supplementation, would be recommended for the alcoholics too.
Right. And then there is also thiamine deficiency.
There is a lot
vitamin.
of, like the vitamin A deficiency is one of the important one too. So like with the zinc deficiency, and then there is the major complications of alcoholism due to that, because of the there is the impaired liver. Due to the impaired liver function, there is like the not absorption of all these.
So these are the fatty
yes.
Vitamins,
Yes.
like vitamin A, D, E. So when we have that fat absorption issue, that definitely affects the absorption of vitamin A.
Vitamin A too as well.
All right.
And then the carnitine is the other one.
And that's an amino
which
acid.
is amino acid, and which is also very important, and that also due to that fatty liver disease, the absorption is it affects the absorption,
Right.
and that can lead to the many things too. So
And the carnitine is an important amino acid for detoxification.
for the liver, through the liver.
Exactly. So, by compromising the carnitine, zinc, and vitamin A, the detoxification is going down the hill.
Yes. So by supplementing carnitine, it reduces the serum triglycerides and the liver enzymes levels, and it increases the HDL, the good cholesterol level.
And
So
here we go. Now we are starting developing the cardiovascular issue.
yes. And then the different amino acids as well.
Right. So I think we will take a short break as we are covering really nutritional aspect, how alcoholism and alcoholic abuse affects our diet. So folks, in order to call us, 1-844-301-1250. That's a direct line to the studio, and we are covering about alcoholism. Even if you do not feel like calling, please stay tuned, because it's a very important topic, and I'm sure you, after learning about it, you will be able to help somebody or can be helped yourself. So we'll be back right after a few small break.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022.
All right, folks, this is Dr. Shailinder along with my co-host Dr. Anju Sodhi, and we are talking about alcoholism and alcohol abuse and its effect on our health. Before the break, Dr. Anju was covering about how it causes different nutritional deficiencies. And so what other nutritional deficiencies?
Yeah, so we talked about like the zinc, vitamin A, carnitine, amino acids, so very important, and it has effect with the liver detoxification. So then other one is, Dr. Shailinder, vitamin C is very important. And in one study, it was found that 91% of the patient with alcohol-related diseases, supplemental ascorbic acid helped to ameliorate the effect of acute and chronic ethanol toxicity.
So that's drinking alcohol.
Yes, drinking alcohol. So, like that tells that the level
important.
decreases. The
So
level decreases. So it's very important to supplement with the vitamin C.
So what
as
you're
well.
saying is the people who drink alcohol, their ascorbic acid in the body, the storage goes
down.
And
As the heavy drinker, like when they're it also affects, like, because their dietary intake is not well too. They are not supplementing. And then the levels are deteriorating due to the heavy drinking. And then also the B vitamins are very important.
That's amazingly true, because we know that people who drink a lot of alcohol, sometimes they feel like that feeling of that they are in the boat, and that feeling of shakiness around and tremors in the hands and neurological type of symptoms do occur in heavy alcoholics. And the people think that the boat feeling, that is very common with this type of deficiency, right?
And
Dr.
the
Anju?
thiamine deficiency and the pyridoxine deficiency is it's very low. So supplementation with the B vitamins is also very important when we are treating, when we are helping someone who has the problem with the alcoholism. And magnesium is the other one, which is also very common in the magnesium deficiency is very common in the alcoholics. And this deficiency is primarily due to the alcohol-induced renal hyperexcretion of magnesium.
Okay, so first you're drinking alcohol, and then what body is doing? Okay, well, we don't know how to deal with, because there is an interaction between ethanol and the magnesium mechanism. So it kind of, kidneys are all of a sudden start pushing out the magnesium storage from the body.
And sometimes the cardiomyopathy considered maybe due to the thiamine deficiency, it may be due to the magnesium deficiency.
See, as well.
Because magnesium is great for the cardiovascular.
Right. And the magnesium, where does it get stored? Folks, it does get stored in the muscles.
Yes.
And that's why when sometime if you say, I got a cramp in the muscle, and and we tell you to, okay, well, maybe Epsom salt soak can help you. The reality is that you can absorb through the skin and also orally take it. But when you drink the amount of alcohol we're talking about, you're excreting out more magnesium, and the muscle cramping and cardiomyopathy, which is heart diseases, can develop because of the thiamine deficiency along with the magnesium deficiency, or only with the magnesium deficiency, right, Dr. Anju?
Yes. And then other one is the selenium.
Wow.
Which is also the trace mineral selenium is an important antioxidant. And it works with the vitamin E to prevent alcohol-induced lipoperoxidation. And so the low dietary intake and the intake and plasma and urinary excretion that affects it. And then there is lower levels of selenium.
Yeah, so selenium, folks, is so important. It's very important. And the reality is the alcohol issue is much bigger in the men, though women are also, we have statics, which I can probably cover later on. And the guys, you do need zinc, and you do need selenium.
Very important because it's lipid peroxidation.
Right. So not only for the cholesterol management and all that, but it's also good for the prostate health, because it gets affected. The BPH, which is usually occurs in the benign prostatic hypertrophy and all that. If you're drinking alcohol, or even the prostate cancer or the other types of cancers, and you're losing zinc and selenium, these are the two very important minerals to protect you from the cancers, but also for the benign prostatic hypertrophy.
Yes. So the other ones are the omega-3 too,
essential
fatty acids. Those are very important, and that get depleted into the alcoholics too.
Right.
And
the reason is because it affects the liver.
It affects the liver and
cirrhosis on the fat.
And also not the enough dietary, that there is the dietary deficiency too.
Right.
Into that. So so those are some the nutrients which can be addressed when we are trying to help some alcoholic.
And what do you think is an Ayurvedic? What is the Ayurvedic approach to it?
So Ayurvedic, as I mentioned in the very beginning, that it has considered as a toxic. It's a toxin, and when it's as we know, with the Ayurveda, and a lot of people might know, arishtas. We have a lot of asavs and arishtas too. So in the old time, it was made with a lot of the herbs and the vegetables and the fruits and the leaves and the roots. So the preparation was different. And in the Ayurveda, they do say that when to take. It's a strict rule who can drink the alcohol and who cannot drink the alcohol.
Right.
So it's like if we combine the modern or the like, it's similar, like, like, and then it's also mentioned that which food you should be taking, what type of food you should be taking, what type of condition you are in, what type of even like alcohol is saved in what type of container. So there is a strict rules according to the Ayurveda who can consume the alcohol.
And how often?
And how often. And then it's clearly tell like
it's much more as a medicinal use.
It is as a medicinal use. And
those asavs and aristas are actually made with the herbs which have that type of effect. It's a delivery method of those herbs which actually has a healing power.
And it's like very delicious, and it has the different, it's considered as a wine, but it has the different effect on the body.
Yeah, depending upon, there are different aristas which are actually more bitters, and then there are asavs which are sweets. So, depending. But again, all those asavs and aristas which were the wine or alcohol content, which is close to 4 to 5% or 6%, I always consider them as a delivery method to it. So the people who are taking the Ayurvedic approach, when we discuss about alcoholism, and there is always mention about it, you need to reduce it, you need to cut down intake of it. So, and usually people who are alcoholics, I don't even recommend them drinking even a 1 drop of alcohol, because it starts the same behavior pattern.
Then also, like when we are treating someone like alcohol, like it's very important to seek the help, and family and the friends, they have to play a major role in it too, to help the alcoholic person to, like, it is treatable. It's not like it can't be done. So, but it's like really you need to help that person, need to bring that person on the board, and then there is like close group of the people. So it's worth doing it.
Right. And the one thing for my the folks who are listening to it, whenever there's an alcohol issue, the first thing is you have to admit that you have an issue around it. Especially you have to say, I have a problem with it. Unless you recognize this, you won't be treated. You won't seek a help, because that's the first thing you need to understand. So also, it's like I always advise going into AA meetings. Alcoholic Anonymous meetings are important. And if things are beyond your control, maybe you need a hospitalization, where the long-term treatments can be planned for you. So and in the controlled environment, along with the counseling, and with that is trying to modify the social behavior, and addressing the underlying issues may be needed as well, because like we said, there is a usually component of depression in the alcoholics, which have to be addressed when it comes to treatment plans. So now, what other things, Dr. Anju, we should be considering?
So I think like we should be a little bit talk about the diet, what type of diet they should be on. So like first of all, we need to cut down all the simple sugars. So all the juices, all the like the simple sugar has to be completely stopped. And then
the reason behind that is usually
that's because of the hypoglycemia, and then it leads to the diabetes.
Okay, diabetes. So because they crave more sugar.
They crave more sugar. If we will not cut that, the body will keep on craving more sugar, and that they are already, because we are, if someone is alcoholic, they get hypoglycemic due to and
the
then
sugar metabolism,
and then they are, if they are eating more simple sugars, that
because they want to bring it up, and
they don't feel
so
good.
Ongoing, it's not uncommon in diabetic, actually in alcoholics, that they do develop diabetes if they keep on drinking alcohol the way they drink, right?
Yes.
Okay.
Same time, like in the simple carbohydrates, in it, like all the white flour and the potatoes and everything, all those starches need to be decreased, and increase in the complex carbohydrates would be great. and the different grains and the complex.
So the
whole
complex
grains.
carbohydrates are
Whole
examples
grains,
like whole grains,
vegetables, beans, and when they're treating for the cirrhosis of the liver, like the low protein diet is recommended, but the meat protein should be low. But they can eat the beans and stuff. Vegetarian diet would be more recommended.
Yeah, so the proteins from the vegetable source would be more acceptable.
And then, as we mentioned earlier, that there is a deficiency of the different minerals and vitamins. So then we need to supplement with the vitamin A, vitamin B complex, vitamin C, vitamin E, and magnesium, selenium, zinc, carnitine.
So these are all the things which they need to be taken on.
They need to be taken on the regular basis, and also the other thing is like the probiotics, lactobacillus acidophilus.
Yeah, because the alcohol actually washes out all the bifidobacterium, the acidophilus in the gut. So we need to replenish that. So that's the other reason why the malabsorptions and food allergies.
That is the major thing too, the malabsorption due to the lack of the good bacteria.
Good bacteria, and those are the bacteria which really need it for a great health. So that happened, and that's how the body is also not detoxifying, along with the compromised liver.
Yes.
So Ayurvedically, what we need to do is actually when we do is, I always consider as a Panchkarma program.
Panchkarma program, it would be great if somebody has that. And we do get the people, they come to the clinic with this reason, and then they get benefited too. So Panchkarma is a detox program, and it includes the massage.
And it's a 5-step detox.
It's a 5-step detox. The first step is the massage, and then and before that, actually, there is oleation, which is the Purva Karma. And then the massage and the sauna is which goes same day, for 5 weeks, twice a week for 5 weeks, and then patient goes for the fasting.
And it can be modified. The Panchkarma, the one thing is, if we see if there is a issue with the mental, then there is a different special treatments which we call Shirodharas, the head massages, and all those things are actually variable. Along in this detox, the lymphatic drainage is very important.
Very important.
And when we're doing a Panchkarma, the main emphasis is to getting the detox done with the lymphatic drainage, along with, while these individuals not only doing the Panchkarma, but they also need to be having counseling done. They need to be part of
yoga therapy, counseling, meditation, diet, exercise, supplementation. So it's a complete we guide them accordingly, and
they need to be seeing they should be doing AA meetings on regular basis. In fact, sometimes having a family, if family is involved, then the whole family.
That I called earlier, it's very important to have a close family or the group or whomsoever is ready to work.
Right. The idea is the individual who's having this issue sometimes doesn't understand they have an issue until they start having medical issues or mental issues, other issues, which leads to a family into distress. So it's a very financially burdening for the family. So the goal is not to get there, but get detox early and keep on attending Alcoholics Anonymous meetings on regular basis and talking to the counselors, and also letting your friends and relatives know that you have an alcohol issue and they should not be offering you an alcohol. And also, you need to make up your mind. There is a study which indicates about 40 to 60% people do relapse even after the treatment, which is a huge. That means more than 50% of the population go back to drinking habits again if they do not continue to seek a help, or if they do not have a help from the friends and family. So family have to be equally involved, friends have to be equally involved when we are talking about the treatments in the alcoholic. So, we're not only mentioning about what happens to your liver, what happens to your heart, what happens to
it's the whole. It's like a lot of things get affected.
And the family
not only
affected.
You get affected, it's your social life get affected. So detox as fasting, purging, people purge too, and then the colonics.
So that's part of the 5-step detox.
5-step detox, and that is very good. And our clinic number is 425-453-8022.
Yeah. So in order, if you we both practice at Ayurvedic Naturopathic Medical Clinic in Bellevue, and usually we say you can call us at 425-453-8022. And not only we do detox, we see lots of other types of cases too, where we help with the different types of addictions. And addiction is really a issue which is a very much can be problematic, and it can be very much of people feel guilty about it. The one thing is to seek a help when it comes to alcohol.
Very important.
And also to realize that you have a problem with it. So folks, that was the topic for today. And we definitely appreciate your tuning in today and listening to us, and hope you will come back and listen to us next week.
Thank you.